Good evening and welcome. I'm Chris Parnell.
Reporting from Moscow,
Tbilisi, Times Square.
May your dreams be your only boundaries in life.
Hello, welcome to Mentors. My name is Tracy Speak and I'll be your host. Webster's defines mentors as wise, loyal advisors. This program seeks to serve as a forum for seniors to share their wisdom with Memphis and the surrounding locale. We hope to address the life issues that seniors face. Mentors are wonderful people that make significant contributions to the quality of life. The Hamilton Eye Institute is an outstanding eye care referral facility that diagnoses and treats complex diseases of the eye. Superb specialists in ophthalmology from across the United States have been assembled to serve here. They provide patient care as well as conduct groundbreaking research. This Eye Institute, one of the nation's best, honors 3 generations of Hamilton ophthalmologists. Dr. Ralph Hamilton and his wife Barbara are lifelong philanthropists, and both have been heavily involved with the Eye Institute and Methodist hospitals. Ralph is a professor of ophthalmology at the College of Medicine at the University of Tennessee Health Science Center, and Barbara is a longtime hospital volunteer. Joining in today is Dr. Barrett Hike, Hamilton Professor of Ophthalmology of the Hamilton Eye Institute in the Department of Ophthalmology, College of Medicine at UTHSC. Welcome, gentlemen. Dr. Hamilton, this has been your dream, and so tell us about this miracle and how it began.
Well, I had the good fortune to be trained in an institution similar to what we have here now, called the Wills Eye Hospital, and I saw the potential advantage of having an all-eye institute, and I had hoped to do that here, but I was never able to do it, although I struggled with it for several years, probably 40-some years. And finally, when we recruited Dr. Barrett Hike to come here, he was able to do it and did a wonderful job here, and we're so very thankful for his coming here and doing all the things that he has been able to do here. We had a very small department. It was very high quality. It was very small before he came here and consisted of what, about two ophthalmologists, I think, maybe 3.
3.
And now at the Eye Institute here, now we have, what, 40?
40, over 40.
Over
yeah.
40. And so we're very thankful for all of that. And we feel like we've come a long way to helping to educate young physicians into ophthalmology, as well as do basic research, as Mr. Speak mentioned. And that's kind of the background story of it here.
Well, there was a lot of hard work took place making this happen. Barrett, you were the driving force behind all this. We had to go down to New Orleans and steal you, so tell us how you helped make all this happen.
Well, I had received some letters of inquiry about coming to Memphis and serving as chair of the department, and in all honesty was very happy where I was at Tulane University in a wonderful professorship and a very busy practice and research lab. And so I wrote back thank you, but I'm not interested. And then after a couple more calls from friends around the country who said you're a perfect person for this opportunity, I agreed to come and visit, and I met Dr. Hamilton, picked me up at the airport, and by the end of the 2 days I was there, I was so inspired by him and had so much faith that I was willing to seriously uproot my family and leave my home and moved to Memphis, which I'd never been to before till that interview. And the rest has really worked so well. Ralph's quality and inspiration and his ability to attract others made the job very doable, and we were very fortunate to have a number of foundations and individuals that stepped forward, and we built something that all the feasibility plans said was impossible, and so we're very proud of that. And mostly we're happy because of the results, and that patients are having extraordinary care, both those with very rare diseases, and those with common diseases, those without resources, and we consolidated a number of clinics, maybe 7 clinics down, all into one institution, which allowed us to have super specialized care and the finest equipment available.
Well, I know that you brought some photos that you might like to show. So, Dr. Hite, y'all have brought pictures of the Eye Institute. Let's review them.
Well, this is a photograph of the Hamilton Eye Institute, again inspired by 100 years of Hamilton ophthalmology throughout the state of Tennessee and 3 generations. We were very fortunate that the Baptist Memorial Healthcare Foundation was willing to donate this facility to us for renovation, and we were fortunate to have gifts from a number of individuals and foundations within Tennessee and from around the country to help renovate it 1 floor at a time.
Wow. And our next photo.
The Department of Ophthalmology has a storied history. It's 102 years old now. These are the different chairs that have served it over the last century plus. And the first one you'll see up on the left, Dr. Ellett, actually brought the first board specialty of any sort in the country to Memphis. The testing was done here. The American Board of Ophthalmology was established, and he was a key leader of national ophthalmology. And then there's a host of others, including Dr. Philip Lewis and Dr. Roger Hyatt, and then Dr. James Fleming, Chris Fleming, who unfortunately had emergency surgery today, or else would be sitting here with us.
How wonderful. Well, we'll return and begin and look at these other photos, and then we'll talk about diseases of the eye when we come back. It's going to be a great another section, so hang with us, and we shall return in a minute.
Check it out.
When it gets cold, feels like the end. There's no place to go, you know I won't give in. No, I won't give in. Keep holding on, 'cause you know we'll make it through, we'll make it.
All right, let's continue with our visit through the Eye Institute, Dr. Hamilton and Dr. Hike, who have joined us today. Let us continue.
Thank you, Mr. Speaker. As we were saying, the Hamilton Eye Institute is a unique institution. It has 4 major missions. First is advanced clinical care available to all with or without resources. The second is to teach, and we teach 500 medical students, and we teach a number of residents and specialty fellows, as well as perform postgraduate education for ophthalmologists that have been out of training for a while. Then we have a major research focus, and we have a major public health focus to improve both knowledge to the public about eye disease, which we thank you for having us here today, and also to help alleviate preventable blindness.
And I know you've got an excellent children's segment.
We do. We're very fortunate. The Children's Foundation of Memphis supported and basically kind of supervised the design of it. My original design was kind of boring, and they came in and it was very functional, but it was not the kind of cheerful enough space. And I was fortunate that their leaders were willing to sit down with the architects and redesigned it. And if we have a photograph of it, it would, I think, make you all very happy.
And not
We do have.
Mm-hmm.
Yeah, and not so frightening to children, certainly.
Yeah.
I know you have an extraordinary auditorium that y'all give lectures in and that people come and appear.
It's probably one of the most advanced auditoriums in any medical school around the country, and it's not only used for ophthalmology, but many times is borrowed by other significant entities or groups that need to have sophisticated audio visuals. The auditorium was donated and designed by Jerry Freeman and his wife Ann, and it's the Freeman Auditorium. It seats 100 people. It has the most advanced AV technology possible, including three-dimensional viewing, so you can view things from the operating room and everyone can see exactly what the surgeon sees. Or you can pipe, we're perfectly set for piping on the internet and for having live conferences across the world, and have had a number.
Well, tell us about this incredible surgery.
The surgery suite was designed by Dr. Chris Fleming, and ophthalmic surgery is very delicate. The equipment is incredibly expensive, and it requires expertise in maintaining and utilizing it, not only from the surgeon, but from the surgical nurses, the surgical technicians, everybody involved. So we were operating in about 6 different hospitals, and so you'd be running all day to different places. And then we were fortunate that the Baptist hospital system and the Methodist hospital system partnered together with UT to create an entity that replaced a number of other facilities and reduced their need. And so now it's purely an ophthalmology surgical facility, and everybody that's there knows ophthalmology, does ophthalmology every day. We don't have infected cases come in, so we don't have the problems of hospital influenced infections, and it's an extraordinary facility. And it's used not only by the full-time ophthalmologists at UT, but by many, many ophthalmologists in the community.
Amazing, for sure.
It's been wonderful.
It's St. Jude's.
Yeah. We have very close affiliations with St. Jude Children's Research Hospital and with Le Bonheur Children's Hospital. And although a lot of surgery is done in those facilities, certain specialized procedures will come to the Eye Institute.
And I know that y'all have a great deal of research going on that's important there.
Yes, sir. Our research has been focused a great deal on macular degeneration, one of the most common causes of blindness in senior Americans. And we have a number of laboratories working on different ways of reducing the damage that's done or reversing it, including retinal regeneration and nerve regeneration. And that is very exciting. We have experts that are working in glaucoma, probably the most common cause of blindness in middle-aged Americans, and then expertise in diabetic retinopathy, diabetes affecting the eye, which is the most common cause of blindness for a good deal of younger people.
We have a great number of diabetics here in the area.
Yes, sir, there are. I think that, as we know, Memphis is a city that is afflicted with diabetes, and less than 50% of the patients are getting active screenings to help prevent their problems. So we're working on ways of making that more attainable through remote diagnostic systems. And there's just so much to tell you. It's hard to condense it.
It is. And we're going to talk about some of these eye diseases that you just said that they're working on research in, but also this idea of how do we as patients, what should we be aware of? And you're going to show examples of those illnesses and diseases so that we can do something about it.
Mr. Speaker, could I share one piece
Please
of
do.
good news? The Chronicle of Philanthropy is a national, international magazine that comes out. It listed Memphis as the #2 most generous city per person, per capita, in the entire United States.
Oh, how marvelous.
#1 was Salt Lake City. Memphis was #2, and there were not many others near us that even ranked in, those in the top 10 or top 20.
And that's what helped all this take place.
It is. That's why I wanted to bring it up.
How wonderful.
What a
Thank
generous
you.
spirit people have.
Well, stay tuned with us as we continue this amazing work discussion about what's happening at the Hamilton Eye Institute, and we're going to be looking at some of these diseases that indeed are the bane of eyes that we get to be seniors. Take care.
When we don't talk, when we don't touch, when it doesn't feel like we're even in love, it matters to me. When I don't know what to say, don't know what to do, don't know if it really even matters to you, it matters to me.
Well, you're wrong.
I'm wrong. You're the one who misrepresented the facts.
Misrepresent the facts? Are you kidding?
Your proposal's ludicrous.
My
It's
proposal will
ludicrous.
go
It is
exactly the way I say it
Over
will.
my dead body.
I think somebody needs a timeout.
Oh, that's the power of one.
Civility. Pass it on.
One grain of sand can turn the tide.
So let us look at some of these eye diseases that seniors need to be very aware of. Dr. Hamilton, you're going to start us out as we look at some of these photos and have us talk about some of these most pressing diseases that we face.
This is a picture of corneal edema. This is fluid from the back of the eye getting into the cornea and causing it to be hazy. The cornea ordinarily is clear because you see through there. And this one is damage to the posterior aspect of the cornea here, resulting in a bullous keratopathy here.
And I believe that patient might require a corneal transplant,
Right.
Dr. Hamilton.
That's correct. That would be the treatment for that patient, would be a corneal transplant. This is a picture of macular degeneration that Dr. Hike mentioned a while ago. It's the bane of existence, of seeing, I should say, for seniors and those who are maybe not quite that far along. But this is right in the middle of the eye. You have two visions in the eye, a peripheral vision and a central vision. Unfortunately, macular degeneration damages the central vision, and that's exactly what this is. It's turned a scar here. So this patient would be able to see the big E on the chart, but probably not much more than that. This is a picture of a basal cell carcinoma, a cancer, skin cancer right at the lower lid. The thing that here is a little bit delicate is that it's close to the punctum of the eye where tears drain through into the nose. And we have to be very careful in resecting it. Treatment of this, of course, is to remove it. I don't think any other treatment would be good here. Would you, Dr. Hike?
No, I agree with you, Dr. Hamilton.
But this could be rather easily removed, I think. There's some blood on the retina, I mean on the iris here. You see those little splotches down? That may be a central retinal vein.
When the eye becomes short on oxygen, the body will set out a chemical that says make more blood vessels. Unfortunately, those new blood vessels aren't as good as the ones the good Lord makes, and they're fragile and they bleed easily.
This is a picture of a cataract here, a slit lamp picture of it. The right-hand disc there is the cornea, and then the left is the cataract, as you can see, in, covering that part of the pupil there. And of course, the treatment for this is removal. It's a very satisfying operation for everybody.
If I could just comment
Sure.
on that. Dr. Hamilton is one of the individuals that pioneered modern cataract surgery and has taught hundreds of residents how to do this procedure in an effective and safe way. And there are over 300 million people in the world with blindness from cataracts, which is which is reversible.
Unbelievable.
Yeah. This is a picture here. You see the white vessel up above here. This is a picture of retinal atherosclerosis, hardening of the arteries in the retina here. And you can see the little bullseye macula there, looking at it. This is an obstruction of a central retinal vein here, and you see the sort of described as splashed hemorrhages scattered around all over the retina here, and this patient would not do well no matter what you do probably, but we do try to keep the pressure down and maintain what we can of his vision. This is a picture of diabetic retinopathy. We've already mentioned the fact that diabetes is a common thing in this part of the world. And these are diabetic retinopathies around here, scattered punctate exudates all around the macula. Again, the macula. Also, I don't think this is necessarily made to do it, but this has got a large cup. That optic nerve is to the left there. The 9 o'clock position in the middle of it is white. And probably that indicates damage from increased pressure in the eye, causing increased cupping in the eye. And this will blind your eye permanently. You do not regain vision loss from glaucoma. This is another picture of a central retinal artery occlusion here with optic atrophy, degeneration of the optic nerve, which leads from the eye to the brain. The eye is the camera. The brain actually does the seeing in patients. And here you're not going to get any vision very good at all here. You can see the sheathing on some of these blood vessels around there, the white stuff around the edge of the vessel there. This is a melanoma, which is a cancer type disease. Yeah, that's good. This is Dr. Hike, who's a pioneer in the management of this sort of thing. This is like a mole in the eye. It grows into the choroid, and it is as dangerous as any kind of cancer that you have, I would say. Would you agree with that?
I would, Dr. Hamilton.
This is a peripheral melanoma here. This is a hole in the macula, a degenerative hole in the macula, right? Just to the right of the optic nerve. If you look carefully, you'll see a little rim of tissue around there, and there's a hole there. And we've just recently, in recent years, been able to treat this to do any good with it, but it's still a very serious thing as far as central vision goes. knocks out your central vision. The peripheral vision around the outside is still all right there.
So the key to all this is to make sure you get your hypertension under control, and if you got diabetes, you better make sure that it has proper treatment, and most of all, get to a good ophthalmologist so he's able to help you through these diseases and to refer you to the proper treatment, I would imagine.
Right.
That's correct, Mr. Speaker.
So y'all train how many residents each year in ophthalmology?
Well, we have 5 new ones each year that are selected from 400 to 500 applicants from around the country, and they end up being extraordinary individuals, adding a lot to the community as well as leaving with skills to enhance whatever community they settle in. Many of them stay in Tennessee, and we're very proud of that, and the fact that we elevate access to the highest quality care.
Well, thank y'all for bringing this miracle to our attention and helping us better understand what's available to us and what we need to be doing on our part as patients. So thank you so much for being with us today.
Well, thank you.
Thank you for having me.
Y'all are inspirations to us all, there's no doubt. Seniors, check the best times for the reminders of great opportunities for us in the community as well. And thank you for being with us today for the Mentors program. If you're interested in the air dates of Mentors or any other shows on GHS-TV, go to ghstv.org, where we're also streaming live 24 hours a day. You can keep up with GHS-TV by visiting us on Facebook and Twitter. I came across this excellent bit of observation from Mr. Edward Langley. What this country needs are more unemployed politicians. See you in March.